So, hello to all the viewers. Myself, Dr. Rahul Rajeev, faculty at Doc Tutorials. So, this will be a session to have an overall analysis of the NEET SS 2024 Medical Group exam. Though I say it is NEET SS 2024, courtesy of the National Board of Examinations, the exam is being conducted in 2025. So, this will be a overall paper analysis, and this sort of a session we do every year. Even last year and the year before that as well, we had conducted such overall paper analysis. So we will be going for overall paper analysis now. So with me, I've got Dr. Karthik, who is an endocrinologist and the leading endocrinology faculty at Doc Tutorials for NEET SS and INISS. So Dr. Karthik, welcome.
Thank you, sir.
Yeah. So I think without any further delay, we'll start the session. Karthik, can we have the first slide, please?
Yeah, sure.
So first of all, regarding the NEET SS paper, the first slide is just on the initial impressions that myself and Dr. Karthik will be giving you. So I've just noted a few points as well. And first things first, if you ask me, how was the difficulty level in comparison to the previous NEET SS? So I would say that definitely this is a bit tougher than the previous NEET SS. That is number one. So seeing the questions of this NEET SS, comparing with the previous NEET SS, definitely this exam is the tougher one, number one. So number two, again, an important point that I want to emphasize. See, whenever you talk about national board exams, there is always an element of unpredictability. And I've always stressed this. And even the session that I did a couple of days before the exam, I told you about the unpredictability of national board exams. So they have, that is the only thing that is predictable about national board exams, their unpredictability. So even this time, there was, already before the exam itself, we had the introduction of time-bound sessions. And again, as far as the question paper goes, I think the uneven distribution of questions in terms of the weightage per super specialty subject was very obvious. And you could see that slightly more questions came from gastroenterology and hepatology and rheumatology. And also, surprisingly, certain topics, especially neurology, I think had a relatively lesser weightage for this NEET SS. But if there is any aspirant who is listening to me, preparing for the next NEET SS, please don't take this as a guarantee that, okay, this is the topic distribution or the weightage that is going to come in the NEET SS exams in the future. As I said, please be prepared for any sort of such pattern. I mean, rather than pattern, I would say such sort of weightage distribution changes. Okay. And next, I want to tell you that this paper, I always tell my students that when you have a national board exam, either the paper would be slightly more inclined towards learners or towards thinkers. So learners means, they read a lot and they have good hold in the factual knowledge as well. Whereas thinkers, they have done their residency very well. And if it is a routine scenario-based question, they are able to answer. Even if it is image-based or whatever it is, if it is related to practice, they find it a lot easy. But if you ask me on seeing the questions, I feel that it is, again, favoring the learners, those who are voracious readers. Because you see, the questions that came, if you look at infectious diseases, some of those questions can be attempted only by students who actually read a lot. Okay. And next thing I want to tell is that, see, I'm sure that there are many students listening to me thinking that, I put in a lot of effort, sir. I have gone through Harrison, but I felt that for the kind of effort that I've put in, I may not get the desired result. See, what I want to tell you is that sometimes competitive exams are like that. You might have prepared according to a particular pattern, but again, with such exams like National Board, you will have such sort of unpredictability. So please don't be too critical on yourself. If you have put in genuine effort, at least I'm sure that those questions that came in the exam, of a particular difficulty level, you would definitely be able to answer. So please don't be too critical on yourself for that. Okay. Now, as far as student feedbacks from doc tutorials is concerned, I think one thing what in doc tutorials I feel that we did right is that we had a layered structure for the program. If you look at the doc tutorials NEET SS program, we have got the main videos, the revision videos, the test and discussion videos, the QRP or the quick revision videos, so Harrison tables and flowchart videos. And I've made sure that, when we go to the test and discussion, some of the questions are a notch tougher so as to equip you to all sort of questions. So I think it is also obvious, I saw a few questions like the lissencephaly, which actually featured in one of the LI test and discussions, the glutaric acidemia question that was there in one of the questions. And you can see that a few questions were asked from the INI questions as well. I saw that one question is almost a replica of the INI paper neurology question as well. So I think these are my initial inputs regarding the exam paper. And I think, Karthik, what do you think? You might have got feedback from the students as well, your inputs on the first impressions.
Yes, thank you, Rahul sir, for your detailed insight on the exam paper. So, first of all, I would like to put out the disclaimer that none of us have, either me or Rahul sir, had not attempted the exam, and we have framed this session purely based on the feedback we have received personally from students as well as the responses from our WhatsApp groups. So, one of the stark changes that has occurred this year is the division of those 150 questions into 3 blocks. And almost all the students had given us a feedback that there was an uneven representation of the difficulty level of questions into block A, B, and C. And the block A, which had the first 50 questions, had the most difficult questions, the longer clinical question with maximum number of clinical images. And all these has to be completed within a stipulated time. So this has resulted in students not being able to review the questions once again, and many of them had even missed a few questions. And in that tense moment, the students tend to attempt the questions wrong, and only when they are moving on to these next blocks, they'll be able to know that they have answered the question wrong, but they couldn't go back. So that was one of the, I would say, one of the important changes which has been brought in this year and has negatively impacted the students as far as the feedback that I've got. And when I just went through the questions that we have collected via the student feedback, the first impression that I've got that this is not like the ones we had last year and the year before. Because if you look at the last year, at least around 105 questions, I could say that it is definitely from Harrison. Even in the lesser known topics like, say, cardiac sarcoidosis and some ICD questions which have come last year, but the exact replica lines from Harrison were asked. But in this year, we could say the topics are being repeated, but these are not exact statements from Harrison, which I would like to bring us to a conclusion that probably this would be a replica of questions which would be suitable for appearance in an INI specialty paper. That was the impression that I've got. The endocrinology question, the gastro question is the same level and standard and the type of difficulty that we usually encounter in the specialty paper of INI. Probably they have taken some questions from that pool as well. As Rahul sir told, NP is highly unpredictable and you never know. So overall, summing up, definitely difficult than the previous paper, and the question pattern was also slightly difficult and different from that of the previous years, which we'll be dealing with in a few moments' time.
And Karthik, I also felt that these questions, must have been put forward by super specialist,
Exactly, sir.
rather than
Exactly.
an MD level paper. So that again, I think for the aspirants who are going to write the upcoming NEET SS, again, I cannot guarantee that next year, it is going to be of this sort, or this is probably a signal that next time you have to prepare. But again, I've always told students, prepare for, even easy or tough. You have to have a good range. I've told this range word even before as well. Now, yeah. So I think, Karthik, you can continue. Yeah.
So in this next 30 minutes or so, we'll be briefly going through how we have felt about the difficulty level of the questions, what were the question pattern like, what was the specialty wise question distribution. Again, would give you an idea regarding how skewed the specialty distribution were in this time around, and which are the high yield areas from each specialty where more number of questions were asked. And of course, the $1 million question: was Harrison a major player in this exam, or should we go for any other alternate options moving forward for the upcoming exams? So reminder once again, so this, of course, you have better knowledge and are better equipped in reading through the session because you have yourself attended the session. So this session is not only for those who have attended yesterday's exam, but for the aspirants in the future years as well, who may have not seriously appeared for this exam, would be going full throttle for the coming exams, and those who are in the final years of their medicine post graduation. This video is also for them.
And also, just to remind the viewers, this is not going to be, a discussion video. We are going to just go through the topics from each system. And very soon, maybe starting from tomorrow, we'll be starting the recall sessions as well. But today we'll have an overall analysis, and all of you in the chat box do actually comment on the exact version of the question that was asked. And if you have got doubts in any particular questions, so that we'll be taking note of that. And once we are doing the recall sessions, we'll be incorporating those changes as well. So expecting your active participation in the chat box as well. Yes.
So difficulty level of question, again, how difficult or easy a question would depend on so many factors. Time factor plays an important role. How close were the options, the length of the questions, and how deeply the students have read through the topic. Rahul sir, what is your opinion when you have gone through the entire 150 questions, almost the replica of all the 150 recalls?
So I think, if you ask me, I think the easier way to put it is tougher compared to the previous NEET SS. And I see that one comment from a student related to this. Sir, if every year pattern changes like this are happening, it is affecting the confidence level. First of all, let me tell you, I don't think this is a pattern change. It is just that National Board always has this unpredictability. So the thing what we as, aspirants should do is, you should be preparing for a sufficient range. Next year, you might see that majority of the questions are Harrison based, just like the previous year. But the point here is, this time it is like a super specialty paper with this uneven distribution. So somebody who might have prepared for gastrohepato, they might get a slight advantage over others, which actually should not be the case. If you look at the neurology papers as well, I'm finding that it is not an even distribution, even for topics. Previously, if you have gone through, the discussion session by myself and Dr. Karthik, you see that neurology, most of the important topics were touched, but that is not happening here. So I would say that the exam, the difficulty level is from moderate to tough is what I would say. And definitely, without any doubt, tougher than the NEET SS paper. And I have always told students, if the paper is tough, it is tough for everyone. So don't lose hope, because if you have at least, done the paper decently, you will get good rank. Okay.
Yes, sir. I remember last time where we have put around 40 to 50% of the questions was easy last time, where 30% was around moderate and 20 as tough last time around. I would say more than 50% would be coming as moderate and tough. I would say around 60% would be moderate to tough, and only 30 to 40% would be easy this time. Agree, sir?
Absolutely, absolutely. Definitely on the tougher side, almost 60% moderate to tough range. Okay.
So
this is the, you can just go through the QR code of the Instagram page of, myself, Dr. Karthik, and the Doc Tutorials Super Specialty page as well. So very soon, we are having certain sessions for the INI as well. You can keep yourself updated. Every year we have these academic discussions for INI as well in separate WhatsApp groups as well. So you can just follow us, and we'll be actually notifying you on the subsequent INI announcements as well by Doc Tutorials. Okay. Yeah.
No. So first agenda, the specialty-wise distribution, and this is in stark contrast with the way we had last year. Again, there could be some overlap between the specialties because some conditions may be shared by both specialties. But this is what we had appreciated from the questions that we have recalled compared to last year, where the neurology, gastro, and endocrine had the maximum number of questions. Here you can see neuro only 11 questions and endocrine only 13 questions, with 7 questions, 6 questions from nutrition. And the two major players this year were gastroenterology with around 27 questions and rheumatology with 24 questions. If you take some of the other overlap questions as well, the rheumato number would go as high as 26 or 27. And
Karthik, for a NEET PG paper, gastro, hepat, and in the rheumatology are relatively taken as the shorter,
yes, yes,
the minor subjects within medicine. But if you see the representation, it was more towards that.
yes, sir. The major topics like the neurology, the cardio had lesser representation, even though I have to say some of the cardio questions were very difficult, where DM exam level questions were there with respect to the cardiology paper. So is the neurology also, some of the images and inborn errors of metabolism pertaining to neurology.
Just one observation also. What I felt is something, that actually affected many students was that set A. If the questions of set A was actually coming in set B or C, at least they would have got the time, to acclimatize. But what happens is when you go to the exam hall and when suddenly you have got tougher questions coming in the first set, you're just actually coming into the momentum. I think that probably was a bit unlucky for many students, at least I suppose. That's what, as an observer, I can actually say.
I think it's very unfair from their part also. Like they had to face the chin music
Yeah,
right up front.
it
The
should have
50
been even.
questions.
It should have been even. It should have been even, at least for the set.
Definitely, sir. That
These are
carryover effect
unplanned
will definitely be
strategies
there
that they did.
while they were attempting B and C. It could have resulted in them getting more questions wrong because of the thought process of having gone through that difficult part much earlier. So this is how we have analyzed the question distribution as. And moving on to the individual specialties, and just to mention how it was different from the previous years. Last time we had so many questions from bone mineral metabolism and diabetes and obesity, but this time almost nothing from bone mineral metabolism, whereas there were 3 questions from pituitary, one with regards to the craniopharyngioma, sarcoidosis with diabetes insipidus, and primary polydipsia. In our important question discussion also, we have highlighted the posterior pituitary being a very, very important area, and likewise, 2 or 3 questions were asked from the pituitary this time also. And one question from HNF1 beta MODY 5, where a young female with uterine abnormalities, and again, diabetes with proteinuria, the ideal antihypertensive question was there. And some of the surprise elements, as far as a few students were concerned, was pediatric endocrinology. But I would say all the this achondroplasia, the CAH were well discussed in the QRP as well as in our group discussions. So I don't find any reason why they couldn't answer the CAH as well as the achondroplasia question. The Noonan syndrome question is slightly tricky, but if you know that it is an autosomal dominant condition, then definitely you would be able to answer the points on genetic counseling. Then all the miscellaneous questions, again, reasonably straightforward, but I would say moderate difficulty. The Menmon gastrinomas, the PPIs, the oxcarbazepine causing SIADH, HCG having longer half-life, and FMR mutation causing POI. Then again, the VHL pheochromocytoma, again, a very well discussed question. And if you add to that the nutrition part also, this point was also highly emphasized in our important area session. As much as 6 questions were asked from the nutrition and 4 of them from the vitamin deficiency part. The riboflavin deficiency, vitamin E deficiency, thiamine deficiency, and of course, a slightly type of repeat question from last year, the refeeding syndrome related to hypophosphatemia, then gum bleeding due to vitamin C, and the diet principles in pneumonia and sepsis, where we have to give high protein, high calorie in patients with cachexia. So this is how the 19 questions in endocrinology and nutrition went. I would say not very tough from endocrinology point of view. It would be slightly moderate to slightly easy part. Not really tough questions, but definitely moderate difficulty. So moving on to the neurology part, do you want to take up, sir?
You can just go through the topics. After that, I'll discuss.
Yeah, the images from neurology, sir.
Yeah, so I think, quite a few surprises this time from neurology. And but what I would say that is that it is not the usual distribution that you have. If you look at the topics here, multiple sclerosis, again, important. I've always told that the disease modifying therapies in multiple sclerosis, the drugs you have to read in detail, and you can see a question from that. Then a question on the APLA stroke management. Seizures, epilepsy, tuberous sclerosis, drug to be given, again, expected question. Now, lissencephaly, this was asked in the MCQ discussion video. I have done an MCQ discussion video where a similar question was put, and also there was a mock test where we had an image of lissencephaly. And then question on MR spectroscopy, I think it was just on the identification part. A scenario, a question on Parkinsonism, asking the false statement. Then a patient with dementia with other features of subacute combined degeneration. A question on migraine. Then a question on the glutaric acidemia. I think image-based question, patient with macrocephaly, patient with the imaging was given with the typical findings of glutaric acidemia. But I'll be very honest with you, if I was in your place, when I wrote my NEET SS, I'm very sure that I've not seen an MRI of a patient with glutaric acidemia when I wrote NEET SS. So I started seeing it only after I took DM. That's what I said. Certain questions I feel, slightly on the tougher side. But if you ask me, is this topic mentioned in Harrison? If you look there, you can see in the table, glutaric acidemia associated with dystonia. And if you go through the INI recall videos, I think it is April INI, there is one question where in the discussion video, I have mentioned about the key features of the various leukodystrophies. There I've mentioned about glutaric acidemia and Canavan's disease, Alexander's disease, all these conditions associated with macrocephaly. So those questions, the discussion is actually at an INI, the DM level. That's what I said, slightly unfair for students. And there was another question on hyperglycemia. So this is not at all an even distribution for neurology. First of all, number of questions less, and I'm not getting a representation for all important topics, which was there in the previous two NEET SS examinations. Yeah. So that's what I want to tell about neurology. And again, I'll be coming up with a detailed recall video as well. Please put in the comment section any other additions you want to give regarding any particular question, or in case we have missed out on any question as well. Yeah, Karthik.
Again, sir, there were so many drug-related questions in neurology last time around 7 named drugs were asked.
Anti-epileptics,
Yes, sir.
a lot of questions.
Yes, sir. None of them are here. Okay. So the major player of this year, gastroenterology, I would say gastro would score an average of 20 questions every year. It has been like that since the new pattern of NEET SS has come. So I would say for future aspirants also, don't miss out on gastro, especially on the liver part. Because the liver and gallbladder, these things we have emphasized again and again on the revision video also. The viral hepatitis C, every year there will be 2 or 3 questions in and out regarding the extrahepatic associations, the drug treatment, the prognostic factors. This time also there were 3 questions related to hepatitis C, hepatitis E, the fulminant hepatitis in pregnancy, and of course the incidental detection of HPSAG positivity. What are you going to do next? And the expected line of questions from liver and the standard questions like Wilson's disease, hemochromatosis, Gilbert syndrome, hepatocellular carcinoma. These are all the usual questions that you expect, and some tricky questions like the need for transjugular biopsy, the cholangiocarcinoma management, then you have the autoimmune hepatitis, Budd-Chiari, etc. And the gut part, more or less straightforward questions. These bacterial overgrowth syndrome, Whipple's disease, again a repeat question from last year. The celiac disease, again, this created some degree of controversy because in Schlesinger also, all the antibodies were mentioned to have almost similar negative predictive value. Then the ulcerative colitis management, the diverticulitis, again, straightforward questions. And this question, the biopsy of lesser curvature ulcer, slightly confusing. But again, Prashant sir will be discussing in 1 or 2 days' time. And regarding pancreas also, usually expected question, the least likely cause for chronic pancreatitis and chronic pancreatitis with orthostatic hypotension management. So I would say moderate difficulty for most of the questions with a few tough ones. But the thing is, when I am sitting here in a comfortable mood, with ample amount of time, these questions may sound, say, easy to moderate level of difficulty. But in that time crunch with long clinical questions, with you may be confused which are those important statements, which one should be omitted in such situations, and with close options, even easy or moderate questions may sound as pretty tough regarding the time constraints. So again, gastro, a lot of questions, around 25 of them. So again, you should not miss out on the gastro topics while preparing for the upcoming exams also.
And Karthik, I think this time not many images came from gastro part, is what I understand.
Sir, there were few like the biopsy
Compared-
pictures were there, some endoscopy pictures were there. Because the number of images were so huge this time, I've not been able to sort which was image based and which was clinical. Last time there were around 30 to 35 image, so
I
we
think
were
last
able
time it
to
was
single out.
predominantly image based. Gastro hepat was predominantly image
Yes,
based.
sir. Yes, sir. And hematology, like the last time, slightly lesser number of questions, only one question from the stem cell transplantation, but slightly more number of questions from RBC disorders. Last time, there were few questions from the leukemia, lymphoma, as well as from the monoclonal gammopathies. But this time, RBC disorders were the predominant area. Iron deficiency, sickle cell anemia, one question on hemoglobin electrophoresis asking about the diagnosis of the hemoglobinopathy, and one picture of dyskeratosis congenita. And there were questions on mastocytosis criteria as well as cancer-related thrombotic microangiopathy. So I would always say that a question is made difficult not only by the in-depth level of that question, but also by the closeness of the options which are being provided. And in many of these questions, I found the options were too close to call, and thereby making even an easy to moderate question going into a tough level. Sir, any points to be added, sir, regarding the hematology?
Nothing.
Okay. So again, infectious diseases, just like last year, it is a silent killer. Around 15 to 16 questions would be coming from ID each year, and slightly different from last year, because the last year infectious disease mostly were specific organism or a specific disease based. That means even if you are not like very sure about the in-depth aspects of the disease, just by superficial understanding of the disease itself, you were able to answer the questions in the last couple of years. But this time, there were a few questions where students who have read in-depth infectious diseases part would only be able to answer. Of course, there were a few straightforward questions also, like the empirical antibiotic choice in pyogenic meningitis in a 60-year-old, liver abscess management, the diagnosis of diphtheria, and this was a slightly trickier one, a patient with MRSA pneumonia, what would you do in a patient with low platelet count and a Vancomycin MIC more than 1.5? Then some statement-based questions which created a bit of confusion regarding mumps orchitis, which of the following was true, false. Then straightforward question on rabies vaccination. Then secondary HLH due to dengue infection, which would be the infection investigation of choice. Then staphylococcus toxicity, slightly easier one. Then toxoplasmosis and an HIV patient with hepatic lesions, which was the diagnosis. And there were a few difficult questions regarding rifampicin resistance, amikacin pharmacokinetics, and slightly confusing question on leishmaniasis investigation, and an easier question on the QSOFA scoring. So infectious disease, gastroenterology, these are the topics which would contribute around 15 to 20 questions every time. And ID is such a voluminous part in Harrison also. So it becomes all the more difficult for the students to choose which one is important and which one is not. Any advice, Rahul sir, you want to give regarding how to prepare for ID also for the upcoming years?
So one thing, spot on that you said, sometimes, students tend to neglect ID and just consider HIV and TB as infectious disease. But no, you can see the representation of questions. It requires in-depth reading. That is what I said. Because, in Harrison as well, you've got a good chunk of infectious diseases, but usually compared to what is there in Harrison, the number of questions that come from infectious diseases relatively less, not so less, relatively less. But this time again, you see, you have to read it well and attend the video lectures as well. Dr. Nia sir has put forward some beautiful videos. You have to watch the videos. You have to watch his LI test and discussion sessions as well. That is what I said. You have to prepare not just on a superficial note. The candidates preparing for the next NEET SS, one thing I can assure you, I don't know what is going to be the toughness level, but it is also an indicator that you have to be prepared even for a super specialty level question paper. So have to prepare very well.
Okay. So moving on to the cardiology part, again, even though the number of questions were less for cardiology this time compared to a rheumat or a gastro, but I found many of the questions on the more of the difficult side. So there were questions on LVLA, pressure tracing, and acute MR. There were a question on inferior wall MI and LVH as a part of chronic cocaine toxicity. Then 3 or 4 questions related to cardiomyopathy, one related to HOCM, Takotsubo cardiomyopathy clinical scenario, then ICD, then echo images. There were a few images of echo, pressure tracing, ECGs also, and ECG of limb lead reversal was there. 2 questions pertaining to cholesterol embolism. Then 2 questions on cardiotoxic medications, one about identifying the drug, which is doxorubicin, and one of the false statement regarding the trastuzumab, which causes a reversible cardiomyopathy.
Again, seeing the distribution of questions, this is not what we are used to seeing, because every cardio paper would have some simple dolly questions from heart sounds, JVP, some valvular heart diseases, infective endocarditis. So that used to be the pattern, and maybe cardiomyopathy as well, except last year, I think there was one question on cardiac sarcoidosis or so that was, slightly tougher. Otherwise, if you see, this is something that we do not expect. But again, I think doable questions are there. And I think the student who is going to get a good rank will be the one, who has attended at least, say, in that 150 question paper, if he is able to attend 130, 135, and then, has lesser number of negatives. Because I can see that certain questions are on the very tough side, but the ones that are doable, you have to hit them. You cannot make a careless mistake. So I think the margin of error is very less, because there are some tough questions, are they tough for everyone. But the other questions, you cannot make a mistake. Okay.
Yeah. Dr. Saikat has pointed out that the question on true or false statement was regarding resynchronization therapy and not ICD. Yes, that was a mistake from my part. I got it wrong. Okay. So again, rheumatology, there were
I think one question, students are asking, will there be another exam on 2025? Okay. So I think, it is easier for me to predict, whether my kids' board exam will be there this year or not. With national board, I'm absolutely sorry. I cannot predict it because, but what I would say is you've got 2 INI exams. That I'm 100% sure. You've got 2 INI exams coming this year. Keep studying, prepare for the INI as well. That's what I want to tell you. Even if you have given the NEET SS, I would still request you to prepare for the INI. Okay, I think INI should be your target. And NEET, there is always an element of unpredictability, even for the date of conduct. As and when it is announced, okay, you prepare for that and write it. That's what. But you can never be sure, when is the next exam coming.
So moving on with the rheumatology, which had one of the most number of questions this year. We had around 4 questions from spondyloarthropathies with ankylosing spondylitis, a straightforward question. Again, 1 or 2 questions on psoriatic arthritis and 2 questions regarding reactive arthritis. I would say most of them were easy to moderate level, and slightly trickier questions on rheumatoid arthritis with the mechanism of neuropathy and ulceration. Swan neck deformity, many students had confused it with Boutonniere deformity. Then which are the medication that is ideal for a woman planning for pregnancy with rheumatoid arthritis? Then methotrexate, pulmonary fibrosis, the poor prognostic factor in rheumatoid arthritis, as well as Sappho syndrome. So slightly trickier in the rheumatoid arthritis part for rheumatology compared to the other areas like cryoglobulinemia and granulomatosis and polyangiitis, where the questions were fairly straightforward. And the connective tissue disorder part question, all questions were fairly easy. The malar rash of SLE, the scleroderma causing restrictive cardiomyopathy, and systemic sclerosis leading on to GERD and exertional dyspnea. And again, crystal arthropathy questions, easy ones, acute gout management, and synovial fluid analysis being the best investigation for acute monoarthritis. So again, another miscellaneous questions like dermatomyositis, ILD, the predictive antibody, the NEES test, the adult onset Still's disease, IgG4 disease, steroid sparing therapies, and these NEES test. Yeah. So even though there were around 25 questions from rheumatology, majority of them were in the easy to moderate category, with around 4 to 5 questions maybe creating a bit of confusion and difficulty for students, is what I think.
Yeah, and I think you cannot make a mistake on those easy questions. That's what I said. Margin of error is less here. Whatever those easy questions were, you have to hit them. Okay, if you have gone wrong there, that is when you are in trouble. You cannot make a mistake in those simple topics. Okay, right.
Exactly. I remember your analogy, sir, because in India playing the T20 matches, you always have 4 overs of Bumrah, where the opponents find it very difficult to score on. So you'll have to make use of the lesser bowlers to make maximum runs off. That's exactly what, if a bowler is lesser known, you have to make sure that you are wasting none of it.
Absolutely. Absolutely right. Absolutely right.
So nephrology, again, one of the surprise specialties which had a lesser number of questions this year and even last year as well. Fairly straightforward question on ureteric stone management, the medical therapy.
But again, I think one thing I noted about nephrology is that, again, slightly in-depth, though the number of questions are less. For example, the question on renal artery stenosis, all the questions you have to read it. And there again, you would have this time limitation. So you'll have to read all those options and then come up with the answer. So not so easy, because even those questions that were there, some of them are simple questions, but again, some of the questions required, you to read very, very well, like all the following are causes of pain in ADP, least common cause of pain in ADPKD, like that.
And again, last year, there was a question on renal vein thrombosis, which was the more sensitive, specific investigation. This time it is renal artery stenosis. Again, so much confusion, which is the more sensitive one, less sensitive, more specific one. As sir told, it requires in-depth reading. And the sensitive investigation for EGFR decline, young hypertension with retinopathy, what would be the goal that you have to set? Whether it is the proteinuria, and which investigation will you choose? That was the question. Again, one question on cholesterol embolism, where eosinophiluria was one of the characteristic findings. Again, less number of questions, but slightly on the moderate to tough side, at least 3 or 4 of them. Respiratory medicine, just like last year, there were around 5 questions. The gold category, a straightforward question, and CT image of a UIP pattern was shown, and which was not to be categorized into that question. That was the question. Then again, a straightforward question on ABPA. Then a physiology question on the mediator of bronchoconstriction and the contraindication for lung transplantation. Again, questions from expected areas, even though the number of questions were little.
So I can see a couple of questions, students asking on the approximate number of right answers a topper can expect, or what would be the number of correct responses to get a rank less than 200 in this paper. So just give us a couple of more days time, because as I said, the exam was just yesterday. So we just need some more time to go through the exact recalls, because we have seen most of the recalls, but some of them are incomplete. And as you know that, if certain words change, the answer also can change. And some question that you felt as a relatively easy one might have, a catch to it. So just give us a couple of more days time. And once we get we'll have the full recall, then I think you will be in a better position. And then we'll be, informing you in the group as well. Okay. So I hope all of you are there in the Doc Tutorials NEET SS groups. And I hope that you found those discussions as well helpful for your exams.
So as the question, the more number of questions are lengthier, the recall also becomes less accurate, because there were a lot of confusion regarding whether the question was regarding the first line of management or the best line of management. Even one word changing of one word could alter the answer also. So there were some confusion with regard to some of the questions also. And oncology, the two most
Already,
important
one
areas.
thing I just want to tell you is, many students had asked me, so should we learn oncology or not? So I told them that this is national board. It's better that, you at least learn superficially. And I am glad there, at least some questions actually came. But that's what I said. With national board, there is actually a separate paper for medonc. So many students thought that medonc may not be asked at all. There may not be any representation, but that was not the case. There were a few questions, but that's what I said. Always an element of unpredictability.
And again, sir, most of the questions were from the areas that we have discussed in the previous session also, the tumor lysis syndrome criteria, the neuropathic pain of cancer, the superior vena cava syndrome, and of course the cachexia associated with cancer and opioid associated constipation. Last year also there were so many questions regarding opioids and the regulatory use, what are the contraindications, toxicity. The last 2 years we had 2 to 3 questions. This year also we had so many questions regarding the opioid and other toxicology agents like opioid with barbiturate poisoning. One question was there. Acute alcohol intoxication was there. Then opioid toxicity with naloxone dosage, that question was asked. Then high anion gap metabolic acidosis toxins, and of course the datura or belladonna poisoning with cholinergic features. This was also anticholinergic features, which was also there for the toxicology. Again, these some of these areas like the nutrition, the toxicology, the oncology, these areas we have asked you to emphasize for the exam, and we had got at least 15 to 20 questions from these areas for this exam also. I think
And in
moving
fact, I
forward.
think Dr. Mithun sir has done beautifully those lectures in the app as well. And I had many students asking me, sir, is toxicology important at all for the exam? But see, this is what sometimes, you can have papers where there are more number of questions. And if there is a candidate who has read that well, is always at an advantage here. Okay. And a couple of questions. Will the recalls be discussed live? Yes, we'll have recalls. Please, subscribe to this channel. You will get a notification on the recall videos that will be soon coming up in this same channel as well. Dr. Rimpu is asking group for INI. Yes, we'll have separate groups for INI where myself, will be discussing on neurology, Karthik for endocrinology. That group is very important. We'll be training you both for the preliminary round as well as the final round. For the interview also, mock interviews will be there. So, be in the WhatsApp group for INI of doc tutorials. Yeah.
Yeah, and statistics also, there were around 4 questions regarding the type 1 error, the area under the curve, and some question related to like a p-value or something. I've not got the exact recall. That's why I have not put it as questions. Around 4 to 5 questions from statistics also. So again, the question pattern, it could slightly differ because this is based on the average, the feedback that I've got from the students. Last time, the scenario-based question was around 30 to 40. This time, at least 90 questions were there, which would be lengthy based on the students. And some of the questions which had images also were lengthy scenario-based. So in short, we can safely say that around 100 to 110 questions had a lengthy or a clinical scenario based question this time around. And one-liners and true or false statements strictly would be limited to around 30 or 35. Rahul sir, what's your take on this pattern?
Just one point to tell you that which candidate has given more number of grand tests and has, prepared, has done more MCQs. Definitely they'll have an advantage because since there were many lengthy scenarios, I know that many students had issues with time management. There are many students who could not attempt some questions from set A. So for the future aspirants, please practice MCQs. Sometimes what happens is that you keep reading without practicing much MCQs. So time-bound MCQ practice, like via the multiple grand tests that we have done. I think, Karthik, if you have noticed, I think so many grand tests, we have conducted. So I think those students will definitely get an advantage. At least, they'll be able to adjust the time better and read the question properly and answer.
Dr. Maitri has put forward that I had missed a question from the endo recall. I'm sorry. There was a question on Nelson syndrome as well, where a low ACTH was not a feature in Nelson syndrome. Okay, so that was also there. And sir, you have briefly touched upon this aspect where the previous two exam papers had more questions from Harrison, whereas this one, it's definitely not been prepared from Harrison.
Because, Karthik, if you remember, when we discussed last time, when we said that, we had around 95 questions or so from Harrison, students were surprised. No, sir, we did not have that many in the previous. But retrospectively, going through Harrison, there were that many questions. And, students then messaged, sir, it was there here in Harrison, some exact lines from Harrison. But this one, you can be sure that it was not a paper that was framed from Harrison. Requires in-depth understanding, sure that so super specialists have actually put these questions. So I will not say that this is a Harrison based paper, but the message for the next year aspirants is not that you should not learn Harrison. If I was in your place, my best bet still would be Harrison, because that is what everyone reads, and even for their MD exams as well. Now the only thing is that you will have to do some extra reading, like you will have to practice the question bank, in more detail. You'll have to go, because in doc as well, you have got the Harrison based Q bank, plus we have got the specialty book based Q bank as well. Now I think students who probably would have just stick to the Harrison based Q bank, they might have felt we missed out on certain things. So that's what I want to say. Lesser number, I think, definitely compared to last year. It was not at all a Harrison based paper.
Dr. Nivas is telling new Harrison is being released. Absolutely, it is expected to come in July, August this year. And definitely, we will be putting up the updates from the new Harrison in separate videos in
I
doc
think,
tutorials as well.
we will actually, come up, as Dr. Karthik said, the new updates, we'll be updating the videos as well. Plus, I think, we will do some, additional videos as well based on the super specialty, books as well, which we have done in the LI test and discussion. I think some students actually messaged me, sir, we saw that, this question was there in LI, but we couldn't actually get time. So I think, the final year residents listening to me, please give more time to your preparation. You need to read it thoroughly now.
So the question that every aspirant would want to know right now, what would be a good score according to you? Again, that depends on what is the ultimate rank that you are expecting. But for a good enough rank within 200, 250, what would be the actual number of correct answer? It may not be able to predict the score, but what would be the number of questions? Because last time we had told that those who have scored more than 110 or 115 would get a rank within 200, which almost exactly happened like that. What is your take this time, sir?
Uh, Too early, because yet to receive the complete recall. But seeing the initial inputs, I feel somewhere if you can get between 90 and 105, I think it'll be a good score, is what I feel. But again, I just take some more time. I just want to get the full recall of questions as well. But I think definitely, if last year it was around 115, it definitely has to come down by at least 10 points. Okay.
Okay.
But again, just like there are outlier questions, if there is a super smart student, he can definitely crack. So, Karthik, if somebody is like you there, so he might actually get a good score.
Someone has got a
Otherwise,
teacher like you, sir, then why not?
and I just want to tell that to the aspirants, please don't be too critical. I can see that many students messaged mixed feelings. Some of them said, sir, I think I was able to do good. Some students said, sir, average. Some of them disappointed. But I just want to tell you, it must be a mix of emotions, but INI is coming. INI is coming, and don't be demoralized. INI pattern is, better predictable. And if you can start preparation, because if you look at the doc tutorials app, you've got everything for INI, including all the recall videos. For neurology, the recall videos that I've done, I have discussed the related topics as well. So INI, I think that has to be your goal. Even if you are satisfied with your NEET performance, please do give INI, because NEET counseling, as we know, it might get delayed. By the way, you can just give the INI exam as well.
So that's it. Once again, I want to convey the same message as that of Rahul sir, because many students have been asking that they have the NEET SS exam as not well as they hope for. So what should they do next? Because INI is coming probably in the next 30 to 45 days. It will be coming, and the prospectus will be out soon. So you have no time to waste. You have a good you have a launching pad with the preparation that you have, extensive preparation that you have for the NEET SS exam. So you can build on that. You need not read that much of medicine going into the last month. You can focus on the specialty, and this would be a good opportunity for you. Just like we have said 1.5 years back during the previous NEET SS, and many of the students who had got good ranks in NEET SS, as well as they have got good ranks in INI, and the other way also. Those who had not so good rank, more than 500 to 1000 rank in NEET SS, had got ranks within 15 in INA when they had prepared well in the last 1.5 months. So I'm giving out the same message. So Rahul sir, can you please conclude?
So just to tell all of you that hats off to the effort that you have put in, because it's not easy learning, at this age of yours or us, too much to read. But I think hats off to the effort that you have put. Fingers crossed for the results, because do not worry, even if apparently the paper was not so good for you, because I think it was similar to, the INI level. So that's what I would say. Fingers crossed for the result, and keep studying for the INI exam as well. Okay, right.
Okay.
All right. So thank you everyone for joining, and stay tuned to the Doc Tutorials YouTube channel for the detailed recall videos that are coming soon in this channel. Okay. And also please be in our WhatsApp groups for the INI discussions, which, we'll be starting shortly, maybe tomorrow or day after, we'll be starting the INI discussion groups as well. Right. Thank you everyone. Bye-bye.
Good night.